But what do you think some of the challenges faced by women who are already in gastroenterology are? And can you perhaps give us an insight into some of those and maybe what could be done to counteract them?
Yeah, so I've already talked about, I think biggest problem is perhaps an imbalance in the representation of females, particularly in certain subspecialty areas within gastroenterology. So this includes advanced endoscopy and in leadership roles, both in clinical gastroenterology and academic departments. And so I've talked about some of the barriers. Certainly the visual underrepresentation discourages people from entering the field or progressing in the field, and it feeds into this concept of imposter syndrome, which is often talked about as a barrier for women in any profession. We know that in general, women are less likely to advocate for themselves. They, compared to men, they negotiate less, and when given potential opportunities, they tend to hesitate more. So if there are opportunities for leadership roles, they might feel that they don't fulfill all of the tick box criteria, whereas men perhaps feel more confident and would put themselves forward even if they don't necessarily meet all those criteria. And I think women probably assume that the quality of their work speaks for themselves, but often their achievements are overlooked. So it's really important to empower women and to ensure self-advocacy so that they put themselves forward. So it's important that we, parallel with training, we introduce leadership, negotiation, skills training, and for those already in senior positions within departments, there's gender bias training so that they're aware of the imposter syndrome and ways to tackle that, and encourage women to come forward. But not just encouraging women, also actively having allies within senior position roles who identify females who they think should apply for leadership roles, and can encourage them to apply. An important part of kind of adjusting the imbalance in visual representation of women, particularly, so within the British Society of Gastroenterology and other societies, formal mentorship schemes have been introduced to allow women who are working in environments where the gastroenterology department is predominantly male, to connect with mentors with similar subspecialty interests or academic interests across the whole country. We've also been working with addressing some of the problems that we see at academic meetings or sort of conferences where you see the manel, so these male-only panels, and making sure that we have a network of just as good female speakers who should be nominated and put onto these panels and increase the visual representation of females in these academic meetings and conferences, where we've had reduced representation of women within the field of gastroenterology. And part of this is this patriarchal culture that people within advanced endoscopy are part of a boys' club. It's highly competitive. There has been a great emphasis of technical over communication skills. So ways we can adjust that is to increase awareness of these conscious or unconscious gender biases with appropriate gender bias training. And encouraging female trainees to have early exposure to advanced endoscopy. And a particular barrier has been a lack of access to fellowships within advanced endoscopy that are suitable to females and any trainees who want reduced working hours and more flexible training. So it's important moving forward that we work with institutions to introduce and fund for appropriate fellowships that allow trainees to work flexibly or introduce more fellowships in regions, particularly where there is a paucity of fellowships, so that women don't have to travel very far, which is obviously a barrier if they have family commitments. And other barriers within endoscopy that have been identified, particularly concerns over musculoskeletal occupational injuries. So looking at the ergonomics of the equipment used, we know that most endoscopic dials have a standard size, which is modelled on a male hand, and women on average have smaller hands and are shorter. And so they may conceivably get more occupational injuries secondary to this. So it's working with industry to work on improving ergonomics of equipment with the female in mind is important. And there have also been concerns about radiation exposure in pregnancy, particularly as a barrier to women training in ERCP. So there needs to be much clearer guidance on the real risks and how they can be mitigated.